Okay, good afternoon, ladies and gentlemen. We are resuming the meeting after, I hope, a nice lunch break. I hope you had a time to get something very fast to eat. We need you to be awake in the afternoon session as much as you are awake in the morning session. And we have two speakers, two more speakers, and the first one is Dr. Susanna Merkus from the National Institute of Occupational Health, STAMI. In Dr. Tor-Erik Danielsen's presentation, he mentioned STAMI several times. He mentioned the report on asbestos. He mentioned other reports from STAMI. Now we have somebody from STAMI, from the National Institute, who will talk about manual work and musculoskeletal disorders. So we're very happy to have you, Dr. Merkus. It's nice that we have different perspectives from research work now, and we would be happy to hear what you have for us today. So, Dr. Merkus, whenever you are ready, the floor is yours.
Well, thank you very much for having me here. Do you hear me firstly?
Yes, we can hear you.
And the first slide is also visible?
Yeah, the slide is visible. Thank you.
Perfect. Well, it's fantastic to be able to be here, and isn't it wonderful that in this day and age where we can have internet and online webinars and seminars and gatherings, that we can still have these even under the times of the COVID pandemic. And I'm not quite sure how the situation is now in Kenya, but I hope things are well with everybody. And just to try my little bit of Swahili, habari mabibi na mabwana. I'm very happy to be here, and I hope everyone is well. As I was presented, my name is Suzanne Merkus. I'm a postdoc at the National Institute for Occupational Health in Norway, I have to add. And today we'll be talking about manual work and musculoskeletal disorders. What shall we go through today? Well, firstly, safety is number one, I think, in any occupation, but health follows closely after. And it's very different for the different countries that we work with to identify where we are and what we can do to be able to make sure that employees have a safe and healthy work environment. We'll also go through the musculoskeletal disorders just in general, that they are very common throughout the world, also in Kenya, and they can have serious consequences. There are risk factors in the work environment that can cause or can worsen musculoskeletal disorders, and the most known are the biomechanical and the psychosocial risk factors. And with regards to the biomechanical risk factors, we can reduce them, so we can make sure that the employees have a healthy work environment and a safe work environment by trying as best as we can to use assistive devices, make sure that variation in work exists, and that there are enough breaks to recover from the heavy work that these individuals do. But I was just thinking, I work in Norway, and where I work in the country is very lucky to already have a certain level of safety for their employees. So most of the research that we do now is how to prevent musculoskeletal disorders from happening. And then also we're looking into how to improve musculoskeletal health, not only to prevent that it occurs. But I'm sure in Kenya, might be working more with safety and a little bit with prevention of musculoskeletal disorders. And this is just an example for why safety should always be first. If you work in for example, construction that consists of manual work, it can also be dangerous. Now you see a picture here on the left that is taken in Ethiopia for people working in scaffolding. If people fall, they might break a leg, they might at worst break a back, or even die from their fall. So number one, make sure that everyone can work safely, has harnesses so that they don't fall, and if they do fall, they only fall just a short way. But once that is in place, Then we can talk about how for musculoskeletal disorders, which is something that is very prevalent among occupations with manual work. But musculoskeletal disorders, firstly, is also very common in the general population. A lifetime prevalence of musculoskeletal disorders is about 60 to 85%, which means that anyone at any point in their time will likely have some complaints in their body which are related to muscles or joints. It's also known that musculoskeletal pain or disorders increases as we age. So the more tired we get, the less we might use our muscles, and the muscles change as well over time. So you're not able to do as much, which can also lead to pain. But why is it important as well? Not only is it prevalent, it occurs very often, but it's a high burden of disease, which means that it can cause a lot of life years lived with disabilities. And also in Kenya, lower back pain, as compared with a lot of other countries throughout the world, lower back pain is the leading cause of people living with disabilities. And globally, the prevalence of lower back pain is about 40%. So it is very common. And the consequences of musculoskeletal disorders can be quite severe. They can just reduce the work capacity to work. So you can maybe still work, but you might need to adjust the work tasks, or you might not be able to work as much. Having musculoskeletal disorders also increases the risk for sick leave and disability, which means you might temporarily not be able to work or permanently not be able to work. And that, again, may lead to reduced or even no income at all. And it also leads to a lot of stress. It leads to mental health problems, because on the one side, you might not get the social interaction at work that is very good for your mental health, but it can also lead to stress. How, if I don't have an income because I cannot work, how will I be able to pay for my child's tuition for school, for example? And we know that in work, there are causes of musculoskeletal disorders or situations that make some existing musculoskeletal pain even worse. So the definition that the World Health Organization uses for musculoskeletal disorders is that it is related to a pain that arises from the musculoskeletal system. So it can be joints and muscles and tendons and ligaments. And it is the work that causes the pain or that leads to an aggravation of the pain. And we know that in manual work, that the prevalence of musculoskeletal disorders is highest. And here is just an example from the UK, where we see that in the higher part of this graph, that the musculoskeletal people that rate that they have musculoskeletal disorders in tasks or jobs that are mostly require a lot of sitting, so administrative tasks. In the lower half of the graph, we see longer red bars, which means that more people report that they have musculoskeletal problems, and these are the occupations that usually require manual work. And also it is the same in Kenya. I was able to find a few studies looking at musculoskeletal disorders, for example, amongst nurses. Nursing is a very good example of physically demanding or manual work. There are two studies that were done in Kenyatta National Hospital and as well as in Mombasa County Hospitals, where they show that at any part of the body throughout 1 year, nurses reported, about 75% of the nurses reported that they had pain somewhere. And most of the pain was in the back, but also in the feet and in the neck and in the shoulders. Primary school teachers could be considered manual work. It's not very physically heavy, but they stand a lot of the day. And that can also be defined as manual work. And here, 85% in this study said that they had pain somewhere in their body. Also the back was the highest prevalence, as well as the knees and the neck. The same goes for example, flower workers in Kenya. A lot of people that complain of pain as well. Also, the back is one of the major areas. But here we see amongst the flower workers that they also have problems with their hands and wrists. So it really depends on what they work with is where they have most of their pain. And here's a general model for identifying the factors in the work environment that can contribute to musculoskeletal disorders. In the work environment above the line, we see biomechanical exposures and psychosocial exposures. And for the first part of this presentation, I'll be focusing on the biomechanical exposures. The idea behind it is that biomechanical exposures, they mean that the body needs to move. And because the body needs to move, muscles are activated, which also influences tendons and joints and nerves. And we see that some of this, because moving the body, sports and exercise is very good for the body, can lead to a training effect, so it's very good. But if it's too much, too long, it's considered to lead to musculoskeletal disorders. So what is biomechanical workload? Well, it has anything to do with the body is moving, and usually it requires lifting and awkward posture, so a bending of the body, and maybe also rotating of the trunk. So with biomechanical exposures, we use mechanics in the science of engineering, and we apply it to the body. So what are the angles that individuals work with? What is the force that they have to use with their muscles to, for example, lift? And how long and how far do they lift? So we have the classical biomechanical risk factors are standing work, repetitive work, manual handling, and awkward postures. And I'll be going through these to see what they are related to, which parts of the body. Because if we want to quantify risk factors, usually the most easy way to identify it is, does the worker have these risk factors? Do they do a lot of standing? Do they have repetitive work? Yes or no? But usually that's not enough. And what we mostly want to know is the intensity. So how much do they work like this? The duration, how long? Is it for the whole day or is it only an hour a day? And what is the frequency? How often do they do it? Throughout their day or throughout their week or even throughout their life? And here's one of the reports that my colleagues have been working on, or have already finished what Mr. Suleiman was talking about, one of the many reports that my colleagues have been working on. And it gives a very good overview. Unfortunately, it is Norwegian, but it gives a very good overview over the biomechanical exposures at work, which usually are for manual occupations, and how they can lead to musculoskeletal disorders. And there is a lot that is written about it. But this report is something that's a very good umbrella overview. But I'll be going through summarizing this report with you today. Here we go. So the major risk factors for lower back pain is prolonged standing. So it's not only do you stand at your work, yes or no, but how long throughout your day do you do it? And it's usually individuals that stand for a long time. And what is a long time? It's found that over 4 hours per day is considered a long time, and that can contribute to the development of lower back pain. Also, manual handling. And what is manual handling actually? It means that you do work that requires pushing, pulling, lifting, or as well as rotating or using tools. And it's usually manual handling, especially if it requires force, so heavy work, lifting heavy boxes, lifting patients like nurses do, for example, is also can lead to lower back problems. And another part, risk factor, is forward bending, but it's specifically if you lean forward to pick something up, for example, but if you combine that with rotating of the trunk or side bending, it contributes to the development of lower back pain. The risk factors for pain in the upper extremities, so in the shoulder, elbows, and the arm, we find that for both the neck, shoulder, and arm, repetitive work is a risk factor. And what is repetitive work? Well, we actually have no clear definition of it, but researchers have been using it if you have to do the same type of work over and over again, at least twice a minute. That is what we call repetitive work. Or others say that if you do the same type of work over and over again for at least half of the day. An example for repetitive work is slaughter work, where the slaughterers have to butcher for a long periods of time, and it's the same type of movement that is done for a long part of the time. And it also requires a lot of force. So if you have repetitive work with a lot of force use, that can lead to problems with the neck, shoulder, and arm. And also here, manual handling with force use. So for example, lifting heavy boxes is also associated with neck, shoulder, and arm problems. When it comes to only problems with the neck, an additional risk factor is having work that requires you to flex your neck, which means bending your neck, and only about 20 degrees or more, which could, for example, be even looking in a microscope, a lab assistant working in a microscope, sometimes even office work, if you do that type of work, can already lead to some problems in the neck. And with regards to the shoulder, we as researchers have been looking at what it means to be lifting things, lifting patients or lifting boxes. But what we found is that for the shoulder area, it's mostly if you are working with your elbows above shoulder height, so lifting very high, that is associated with problems in the shoulder. But you don't even have to lift anything. For example, painters also work a lot with their elbows above their shoulder, and that can lead to problems in the shoulder. So what are the risk factors for the lower extremities, so our legs? What we found is that hip and knee arthrosis is related to manual handling. So that again is lifting, pushing, pulling of things and as well as people. And in addition, knee arthrosis is also being a risk factor for that, is a lifetime of kneeling and squatting. So it's not a risk factor if you do it once or twice or even just a few months during your career, but it is those occupations, for example, carpenters that have to lay floors, they're the ones that usually get knee problems because of the amount of kneeling and squatting that they do. And this is another risk factor. Standing a long part of the day we're not quite sure yet, but it could also lead to pain in the lower, in the legs, in the ankles and knees. So now I've mostly been talking about the risk factors that can increase the prevalence of pain. And more recent research has also been focused on what is not only the factors that increase the likelihood of you getting pain as an employee, but are there also things that will increase how much pain you experience? And they found that, for example, in the lower back, if you combine exposures, so if you have an occupation where you do a lot of standing and heavy lifting and forward bending with rotation, as well as manual handling, it's that combination that will not only increase your likelihood of getting pain, but it will also increase how much pain you will perceive. And occupations, for example, in construction, a lot of occupations have all of these exposures. There's another study that has been looking at what does it mean if you would for your whole career have these exposures. And these exposures that they looked at firstly was lifting. If you lift about 1,000 kilos per day, or if you lift more than 20 kilos for more than 10 times per day, they found that it increases the risk for sick leave, which means that you're temporarily unable to work. So this means that you can lift about 1,000 kilos per day. It doesn't really matter how in how many quantities. It can be, say, 100 times 10 kilos, or even 5 kilos, very frequently throughout the day. That can also increase musculoskeletal disorders, and then that leads to not being able to work anymore, at least temporarily. And it's also been found that this is a risk factor, not only for temporarily being able to not work anymore, but permanently losing your job. So now we go back to the model. We've been talking about biomechanical exposures, and I'll briefly go through the psychosocial exposures in the work environment that we know lead to or contribute to the onset of musculoskeletal disorders. And the idea behind psychosocial factors is that there are things in the working environment, for example, how you interact with your colleagues, the type of work that you have, the amount of pressure that you feel that your work gives you, that can contribute to the development of musculoskeletal disorders. And within psychosocial factors, it's very important that there are large individual differences and individual factors that plays a role. So it's not whether per se individuals have colleagues that are not very supportive, it's how the employee perceives it to be. And one worker might think, I don't mind, it's not very supportive, and the other employee will think it's terrible and very stressful. So what are psychosocial work-related factors? They are psychological risk factors. For example, the opportunity for employees to grow and learn new skills and to develop. They can be social risk factors, so having unsupportive leaders or unsupportive colleagues. But they can also be organizational risk factors, and the word doesn't say it, but usually when we talk about psychosocial work factors, we also talk about organizational risk factors. So, for example, how is the work organized? And is there any indication of how, for example, the workload is managed? And the highest evidence that has been found for psychosocial risk factors for the onset of musculoskeletal disorders has been high job demands, as well as high job strain, high effort reward imbalance, and low social support. And high job demands, that means that people perceive that the amount of work that they have is very high. And they mean that they have to work at high paces all the time. At least that's how they perceive it to be. They have very little opportunity to take breaks, for example. And the combination between high job demands, so when we look at the next one, high job strain, is also a risk factor of musculoskeletal disorders. And it is a balance between high job demands, so how much work do you have to do and how high is the pace that you have to work in, and low job control. So how much influence do you have, for example, to take breaks to make sure that these job demands aren't too high. High effort reward imbalance is also a risk factor. That means the amount of work that you put into it and you feel that you do not get enough back is very important. This can be the amount of effort that you put in physically. And the reward can be in money. It can be, do you think your income is high enough? But it can also be, do you get enough praise from your manager? Is he happy with the work that you do? And does he actually also tell you that he's happy? The next one is low social support. How well do your colleagues support you in what you do? Can you go to other colleagues and ask for help, and will they give you the help that you need? If you're, for example, new at a work place, can you go to colleagues and ask for their experience on how to solve situations? And can you do it with your manager as well? And if this is not the case, this is seen as low social support and may lead to musculoskeletal disorders. And the idea behind psychosocial factors in manual occupations, at least, is that they can contribute towards chronic pain. So here we see in the figure that the green line is acute pain. So it can be, for example, that someone gets a sprain, which you can heal from. But it can be, if you the psychosocial factors, if they are there at your work, they can contribute to that they are you don't heal well enough, and you can continue, for example, working with your sprain, and that becomes chronic. Psychosocial factors can also contribute to the blue line, which is the persistent pain, so slightly increased pain over time, which can eventually also become chronic. So what can we do? Well, firstly, risk factors can be reduced. And the easiest way to reduce them is not only to reduce the amount of kilos, for example, that individuals have to push, pull, or lift. But if you have to push, pull, and lift, use the assistive devices that are available so that you can reduce the amount of forces that your body has to generate to be able to do the work. Ensure that there is enough variation in the work. That means that if you have different tasks, that you try to vary one task from the other. But it also means that you don't vary the type of work that you need a lot of shoulder work with, for example, a lot of painting, with something else that requires a lot of lifting, so a lot of activation of the shoulder muscles. But you might want to vary painting with what would it be? With a lot of walking, and going to a colleague and asking them for some help. And this is also, it's a kind of the same as making sure that you have enough breaks, so that when you do have physically demanding work, that you can recover in between breaks, or in between your work. And these can be coffee breaks, they can be lunch breaks, but they can also just be short breaks where you chat with your colleagues for 5 minutes and then you go back to the heavy work that you're doing. We can also reorganize work, which is part of varying work. And how do you organize the work so that it becomes more varied, and facilitate where you can to reduce workload. But the question is almost always how much, and how do you do exactly this? And this is where we unfortunately need more knowledge. But one tool that can help here is something that was developed in Sweden. It is a tool that is a risk assessment tool called RAMP. It is in English, so I really recommend that you go and take a look at it. There are free online courses that start in the beginning, 8th of December, I believe, for anyone who is interested, where they screen the risk of musculoskeletal disorders based on how the pushing and pulling and repetitive type of work. And they also give recommendations onto what can be done within these manual occupations. So just to round off, today we've heard that the risk factors for musculoskeletal disorders can be individual biomechanical risk factors, and especially if we have them over time. And these are standing, repetitive work, manual handling, and awkward postures. But if you combine the risk factors, they will lead to increased pain. And also psychosocial factors play a role in the development of musculoskeletal disorders. And it's important to prevent these disorders And how you can do that is by reducing the workload, increasing variation and breaks, as well as thinking about how to organize and facilitate work tasks so that they are best suited for the employee, and use assistive devices where it is possible. And I would like to thank you for having me here today. It's wonderful to have this opportunity.
Thank you very much, Dr. Susan Merkus, for this very nice presentation. And I must say, I'm very impressed that you could find data for actual situations in Kenya. One thing you mentioned in the presentation, which really I think it's very important to think of, it's how primary school teachers in the reports which you mentioned that primary school teachers standing is a manual work, and the primary school teachers had problems, musculoskeletal disorders problems because of standing. And then I imagine how many primary schools are there in Kenya and how many secondary schools are there in Kenya, and all the teachers stand all throughout the day. Then
Exactly.
you can imagine the how large and how wide this problem with musculoskeletal is. So before we open for questions to Dr. Susano, I want that we go to the next presentation by Mr. Bayo Awosanya, and then we take the questions together so that we save a little bit time. So the next speaker, I hope Susanna, you have time to be with us for the next few minutes, so that after Bayo's presentation, you can answer some questions.
Yes, I will stay here, of course.
Okay, thank you very much. And the next speaker is Mr. Bayo Awosanya. And as I mentioned earlier, those who attended our physical conference in Mombasa in 2019 will remember Bayo, who presented Workplace Health Without Borders. We have Bayo today, who again, and he's going to talk about occupational health and safety management system. Bayo, whenever you are ready, I'll share your presentation.
Yeah, hello, Abdul. Can you confirm you can hear me?
Yes, we can hear you.
Just give me 10 seconds, please. Also confirm that you can see me.
We cannot see you, but
Okay.
we can hear you. That's most important.
I can see you, Bayo.
Oh, right. Okay. Excellent.
Oh, okay. Then it's only me who can see you, Bayo. But go ahead.
Yeah. So good afternoon, everyone. I'm so pleased to be here. And now, as Susan mentioned, it's a different time that we need to do this virtually, and well, we couldn't be at Mombasa or in Kenya for this year. But my name is Bayo Awosanya. I'm an HSC lead working for Shell. I'm also an occupational hygienist. At the same time, I'm a trustee of the Workplace Health Without Borders, the UK branch. And over the past 2 days, you've been listening to different speakers talking about various aspects of occupational health and safety, from risk assessment to different programs to how you manage safety and how you manage health. And what I'm going to be doing this afternoon is kind of bring them all together into a management systems. With the title of my presentation as the occupational health and safety management systems. I'm going to make it a bit interactive. So while I'm speaking, even while your microphone is mute, when I ask any question or when I ask you to react, I'll appreciate if you can put some chats in the chat box as a way of responding. So just because of your bandwidth and also just to give us a bit of focus and to make it a lot more interactive, I can turn off my camera for a couple of minutes. Then while I go through the presentation, then I'll be back on the camera for the general discussion, if that's okay. Is that okay, Abdul?
Yes, please go ahead.
Okay. All right, so if you don't mind, if you can change the screen for me. First is let's have a look at the content of what we're going to be discussing very quickly. This is content. We're going to be having a look at the context. What's occupational health and safety systems? Again, we'll look at the benefits. Why do organizations implement them? Then we're going to see the model of an occupational health and safety management system. Then we'll see the big picture, which helps us to dive into the newly launched ISO 45001, which is the overall acting framework of occupational health and safety management systems. Then for any systems and for any guidance, for any policy, you want to ask yourself who is responsible, who is supporting who. As a result, it helps you to know who are the people defined to implement it in your workplace. Then I'm going to round up with practical steps with how you implement the management systems. An occupational hygienist, at the same time health and safety lead for working in different areas of a business. Well, 80% of my work I've likely been in occupational health and hygiene, and the remainder part of my professional career has been mixed with health and safety. So recently I focused on health and safety, which I have used immensely in implementing occupational health, occupational hygiene, and also to provide support in the area of occupational hygiene, both at consultancy level and also in my various work. So let's go to the next slide. So let's put a bit of context into occupational health and safety management systems. As a way of introduction, it's good to provide this context around occupational health and safety, or maybe in Kenya you say it's occupational safety and health. So it's acronym that organizations use very differently. And this context on how occupational health and safety has become relevant in an organization, I'm sure in your organization, what you should be asking yourself right now, what type of management systems do you operate? Is it a safety management system only? Is it a quality management systems? Or is it an integrated occupational health and safety management system? After this conversation, I believe this will provide you with an in-depth understanding and area and the level where you are currently and what you need to do to take your organization to the next level. We know that in organizations, most of the health and safety programs, they tend to focus on safety. Susan also just mentioned that, yes, safety is first, health comes after that. And because what we often see are the physical hazards that can easily harm people, such as you can see fire, you can see a spill, you can see flying objects, people tripping over items. You easily can see them. So because organizations tend to see protection against these visible hazards as their business priorities, especially in some of the organizations that you refer to as high-risk business sectors, whether you work in construction or maybe in mining, or even if it's just working as part of the Juakali around Kenya, you would notice that some of the hazards you see on a day-to-day basis, they can be high risk and they can easily be managed just by putting in very simple and structured management system in place. So, and especially in places where safety is driven by legislation and regulations. Commonly in Africa, it's still being driven. So in not many countries that you really get the government driving occupational health and safety using regulations and legislations. So what are we going to be focused on? Organizations themselves, they find it very easy to show their commitment to safety because they believe when they protect people which against the hazards that are visible, they are fine. So they easily give you the hard hats. They ask you to carry out inspections, to carry out workplace visits. They ask you to inspect equipment. And gradually over time, health programs were now included, but they were now beginning to be given as much attention as safety. So not just that, organizations also started to realize that the organizational issues, human factors, culture, behavioral safety, they also became very important. And so they acknowledged that the management of occupational safety and health, it requires an integrated approach. So when you combine occupational safety and health with management and system thinking, then you're beginning to have a unified approach. So when I mean system thinking, entities such as organizations or departments are considered as systems. And this comprises of a range of elements: your risk assessment, your occupational safety competence, everything interacting together. And they're all very, very, very important. Let's go to the next slide, please. So let's ask ourselves, why do we need to implement the occupational safety and health? Number one, you want to systemize the occupational safety and health management. You want to have a robust system, and you want to ensure that you prevent incidents, you prevent accidents in your overall operations, and having a focus on your occupational health and safety performance when you implement them. All of these are benefits. And it is also very important to implement it for compliance sake. You want to avoid possible future liabilities. And I also believe in most cases, you just want to do it to get the inspectors off your back. So they don't make you their customers. And there are all the organizational benefits, the economic benefits. The organization wants to show its people that he cares, and also want to provide some kind of care for employees approach, so that the employees also they know that the organizations they do care for them while they implement the occupational health and safety management system. And finally, this list is not exhaustive, but every organization wants to demonstrate they're responsible. They get feedbacks from external stakeholders, they get feedbacks from their customers, they get feedbacks from people external to the organization. So as a way of demonstrating their corporate social responsibility, they want to show transparency that they're a responsible organization. So it's important that this is implemented. Let's go to the next slide. So the next thing we're going to do is, before we go into very interactive discussion, can you please just put in a chat in the box if currently your organization or your consultancy or wherever you're working, you have a management system in place. And why don't you just type in what type of management systems you are actually using? You might be using just one single management system. You might be using a safety management system. You might be using just ordinary policy to drive your risk management. Why don't you just type it in? Let me know what type of management systems you are operating. So while you're doing that, what I just quickly want to mention is that all management systems, right, they're in place to manage risks. They're in place to management programs, and they're designed to be compatible. Why? Because they allow the organizations to implement any or all of this management system just to ensure that it fits their business. Either it is a standalone or as an integrated system. Say, for example, your PPE programs, your PPE management systems, or maybe you call it a respiratory protection equipment management program, or you've got an environmental management system, or you have a quality management system, or you have a Legionella management program, or you have an asbestos management program, or you have an asbestos management systems. All of these are based on a risk approach, and they're used to drive performance across your organization. So these are the major 5 steps. These are the 5 steps that underpin an effective management system, and it's a prominent work which was done around 1920, giving credence to Walter A. Sheward in 1920, who introduced this model, which consists of the plan, do, see approach, as you all use now in safety. And this is just the model. This is the model that underpins every management system. And when you apply these five approaches, it's for what? It's for continual improvement. Number one, you require a top management commitment and a policy, and the policy should be of a general plan of intent. It should guide and influence the decisions your leaders make and you make as an organization. So it's the basis upon which you measure your objectives and your targets, right? Under which your management system is developed. The second one is the planning. This is how you plan to deliver your occupational health and safety policy, your environmental policy, occupational health policy, all the policies that you have for managing risk in your workplace. How you plan it, how you plan your objectives, how you plan your targets to ensure that hazards that are arising from your workplace and from your work activities, they are properly identified, so the risks are properly assessed and they're controlled. You've heard quite a lot about risk assessment metrics. So this is actually where this comes in. So we now go into the third one, which is the implementation. So if you have a plan, you've got to implement it. So you develop the capabilities and the support mechanism which you require to achieve your policy, to achieve your objectives, and to achieve your targets. Once you've implemented, you want to check. You want to measure what you've done in terms of evaluation. So this is the measurements, the monitoring, and the evaluation of your performance. How have you performed in terms of the controls you have in place against your risk management? How effective is your risk management approach system? So that's the fourth bit. And finally, the management review. It's for improvement. You want to continually improve your occupational health and safety management with the objective of improving your overall safety performance. So who does that? As an health and safety professional, it's our role, it's our responsibility to support your business, to support the organization in developing a robust management system. Let's go to the next slide, please. Thank you. So why is it important to focus on a occupational health and safety management system? So let's have a look at some world statistics, and this data are really staggering. I mean, if you look at work-related accidents or diseases every year, it's around 2.7 million, right, around the world. And this data statistics actually arise from data from the International Labour Organization. And you can see for yourself on the screen, 160 million people with work-related illnesses annually, and over 340 million occupational accidents annually. So it's very important to focus on how we manage occupational health and safety using an integrated approach in the workplace. So this data drive continuous improvement. This data drive a global policy. This data drive the way guidances, instructions, information, training are released to organization in order to support them to be able to deliver a robust and a fit for purpose occupational health and safety as management systems. So just while you're pondering over this data, we can move to the next one. So the next slide introduces the ISO 45001 on occupational health and safety management. So just a little bit of context to this. In 2018, the occupational health and safety management systems, it had a new standard, which is the 45001. And this replaced the applicable occupational health and safety OSHA's 18001 standard. All of you must have known about that one. So companies with these standards under OSHA's 18001, they had about 3 years since the publication of 14001 to transition all their systems to meet the requirements of the new ISO standards 45001. The original deadline was extended by about 6 months just because of the corona pandemic, and ended up eventually on the 30th of September 2021. So many of the requirements of this new ISO standards, they include areas where mental health can play a key part in implementation. So now you can appreciate that we're not just talking about safety, we're not talking about quality, we're not talking about environmental management alone. We're now incorporating mental health and general well-being of employees. So what's the scope of this standard? It helps to establish and implement and maintain a robust occupational health and safety management systems. Then it also helps to improve occupational health and safety in the workplace. So your hazards management and how you minimize risk in your workplace are all included in this standard, and it helps you to take advantage of any occupational health and safety opportunities which may arise from your workplace. It helps to address all the management systems non-conformities which may be associated with your activities. When I mean non-conformities, I mean some findings from audits, some findings from inspections that are high risk, which can impact on your day-to-day activities at work. And overall, it helps an organization to achieve the intended outcomes of its occupational health and safety management system. So you'll be wondering what those outcomes are: continual improvement of your performance, then how you fulfill your legal requirements, and also achieving your objectives. This document, these standards, it's not standalone. It's for all organizations, regardless of the size and whatever operations you're doing. So, and it's applicable to all occupational health and safety risk under your organization's control. It takes account into factors in context, all the context within which your organization operates. So if you haven't heard about it, and if you heard about it for the first time, please, it's a very important newly launched management system which we can all buy into. Let's go to the next slide, please. So just in summary, the main characteristics of the standard is actually this. You plan, you do, you check, and you act, and you go again for improvement. We mentioned a lot of risk assessment. It cuts across all your hazards within your workplace. Next slide, please. So who is responsible? Who is responsible? The top management, they're ultimately responsible for the occupational health and safety management system. You remember that they sign up the policy. So they have the overarching and overall responsibility. Even if the day-to-day decisions related to occupational health and safety are delegated to other people, they are still responsible overall. So, however, what is delegated and to whom should be very clearly stated, and it should be unambiguous, and that should be communicated that everybody understands who is responsible. So top management should assign those responsibilities and authority just to ensure that the occupational health and safety management, that it conforms to the requirements, all requirements of the new standard. And the way you report the performance also should be very clear. So, but if you have resources that are limited, then you need to be able to do one thing. You ensure that you integrate your occupational health and safety responsibilities within existing functions of the organization. I'll give you an example. If you have very limited resources in your organization and you do not have enough fund to employ a very highly qualified occupational health and safety manager just for the purpose of implementing your management systems, then some responsibilities of health and safety can be given to supervisors, but you must provide training for them. You must provide training for them. So that's very, 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 very key. But responsibilities must be made very clear. There is a section of the 45,001, section 3.5 or so, which clearly defines the responsibilities of everybody. So if you manage to grab one of such copies, then it means you can easily read and study them very, very well. So thanks. So the next couple of slides now, which will be almost the final slides for this presentation, we'll be talking about practical steps of implementing an occupational health and safety management system. If you please go to the next slide. So yeah, just to let you know that yes, safety is for everybody. So everybody's responsibility is safety. So whether the manager, the management gives you the responsibility, please just note that you are also responsible for the safety and also for managing the risk in your workplace. So last couple of slides, we just going to go through some practical steps. I've listed those practical steps as 6 on how to implement the management system, just in case before now you've not been opportuned to do that. So the first one is appointing a responsible person. Let's go to the next slide. Appointing a responsible person who will be able to help you to drive the transition or the management, the implementation of the management system, just in case you're trying to transit or you've never had it, or you're thinking of having a certification in occupational health and safety. Mundo camera. Yeah, so once you've done that, then you can now set up a team for this project. You set up a team for this project. So that's very important. This is part of the appointment. And when you appoint people for such projects, it's very important to give them a formal letter of appointment so that they know very clearly what their responsibilities, what they are. Next slide, please. So once they have been appointed, then they need to do like a pre-read themselves, have enough information on this standard. It's not free on the internet, but there are some free text on the standards on the internet, but the information you get on the internet will be limited. So the standard needs to be purchased, and they're not very expensive. And once you purchase that, then you do a bit of training. You can train yourself as occupational health and safety professional. It's also part of your self development. And once you've done that, you might want to appoint some internal auditors within your organization so that they can also be familiar with these standards. Next slide, please. Then the next is actually communication. So it's important to communicate very clearly what you plan to do on transiting from where you are to the new standard, or putting in place an occupational health and safety system in your organization. So let everybody know, and also share responsibilities, and let them know the timeline. If you're going to spend about 6 months transiting, all the resources you need, who needs to do what, all of this should be factored in and also well communicated to everybody. And definitely, I believe while you're doing that, it's the overall responsibility of the management of the organization who will sign it off. Thanks. So the fourth one, which is the next slide. So first, you've appointed people to manage this. They have the right level of information. They've communicated to everyone what you plan to do. The next thing is for you to conduct a gap assessment. A gap assessment of your current management systems, of your current occupational health and safety system, because you want to be able to determine what your gaps are before you can put in place some key activities or key controls or key actions to drive your implementation. So, and you also need to align all aspects of your existing management systems to the new requirements. In this case, you don't need to have a formalized management system, but you need to assess what you currently have in terms of the current standard, or of the quality of your workplace health and safety rules. That's just sufficient if that's what you want to do. But you need to be able to understand what you have and where you're going to, and do a bit of gap assessment. The gap analysis, what's it going to do for you? It will show you your status, where you are, and to what degree you're currently implementing occupational health and safety. And so on that basis, you now want to develop an implementation plan, like a roadmap. So that's what you do next. Next slide. So once you've drawn up your roadmap, you now want to define some smart gap closure plan, and also define who is going to close it out, when is it going to be closed out, and in what way. You provide resources in closing them out. Next is to now focus on the requirements of the new standard. The standards requirements are quite clear. So, and you need to use a structured approach, more like doing like a spreadsheet kind of assessment, closing out those gaps. After the assessment, then you want to close those gaps, but you must have a roadmap and make sure that you align the gaps that you've assessed to your processes and make sure that you fit and tailor them to your processes, and the requirements and your processes and the gaps are all aligned, agreed by everyone, and you continually review in your regular meetings before you take the next action. The next action is going to be for you to put resources in place and also to close them out. So once you've done that, before you eventually go live, you want to assess your readiness. So by assessing your readiness, the first thing you want to do an internal audit. If there are findings, you want to close those findings, you want to close them out. And if possible, do a benchmark with an external verification. You might want to invite someone externally to check what you've done, like a dummy run, before you eventually go for a certification. And that's when you can actually have a stamp that you now implementing the new occupational health and safety management systems. So while I conclude, next slide, please. So once you've done all of these, you can have that assurance that you're now beginning to implement the new occupational health and safety systems. And yet having that in place is beneficial. It protects life, it protects your organization from liabilities, it saves cost, and it helps you to comply with both local and international standards. I'll stop here to take questions. Thank you very much. Are you there?
Sorry. Yes. Thank you, Bayo, for that nice presentation on how to put up a functional occupational safety and health management system. Because I insist on the word functional, which makes the OSH management system beneficial. So I will call back Dr. Suzanne Merkus, so that we can have some few questions and some short discussion. I can see there's already a question in the chat, and if you wish to speak, please raise your hand. Otherwise, you can just write the question in the chat. There is a question, I think this is for you, Suzanne. Thank you, Doctor, for the insightful presentation. What will be your advice on how to handle MSDs related to use of laptop computers? With working at home, this now is a major issue. So what will you say?
Absolutely, and this is a very interesting and very relevant topic. I wouldn't firstly consider laptop work to be manual work, but it's still work that can lead to musculoskeletal disorders, specifically in the short term, very acute and painful musculoskeletal disorders, specifically in the neck and in the shoulder area. And anything that has to do with musculoskeletal disorders, the first that we always say is, can you prevent it from happening at all? And how can you prevent it from happening at all is by providing individuals with the suitable tools. And when it comes to laptops, where you sit often with your neck bent forward, and as we saw in the presentation, even just 20% sitting with your neck, doing work when your neck is bent just 20 degrees forward, that can already increase pain there. So if you have a support where you can raise the screen of the laptop, that would already help to be able to lift up your head. But that also means that you need extra keyboard. Another way to prevent it from happening at all is to be also make sure there is enough variation. In this case, it would be breaks. So every 15 minutes, every half hour, get up, move around, get yourself something to drink, take that telephone call while you were maybe walking around. Those are things that really help so that your muscles get to relax and the blood can keep flowing through your neck and shoulders. But once you have problems already, the suggestions are also to take enough breaks, but physical exercise is something that is absolutely advised. And for people with laptop type of work, so who sit a lot of the time, the type of training is help me here, Abdul Qadir. Konditionsträning.
Aerobics.
Aerobic, yes, sorry, thank you. Aerobic type training, so running, cycling, fast walking, as well as some specific strength training for the areas that you have problems with. So specific training for your shoulders and neck area, specific training, strength training for the back area can also be very helpful there. I hope that answered the question.
Thank you very much.
I can also add, if you allow me to just chip in something on use of visual display units and use of laptop for people who use computers for longer than maybe 3 hours, 4 hours continuously. It's also advisable to kind of do some eye muscles exercises by just looking away from your computer every so often at a distance, and also regular blinking. So if you look away for 5 seconds and blink and come back, then it helps you to kind of relax your eye muscles, because just looking at the screen for a long time can actually cause dryness of eyes, and also can cause eye aches, and eventually leads to what we call dry eyes, which I experienced once during COVID, because I was working hugely on the laptop, and I wasn't using a display unit. I wasn't using a screen, so that can be very useful.
Absolutely.
I hope that's useful.
Yes, because when we talk about breaks, we talk about anything from what you're saying that can be as short as a few seconds of looking away, and making also sure that your eyes that are used to focusing on a very short distance also can focus on something that is further away. So that's just a few seconds until a few minutes, getting up and walking around, 10 minutes, grabbing a cup of something to drink, and also lunch breaks that are half an hour. And make sure your days are not too long, so that the breaks that you get in between your days are sufficient as well.
Okay, just a quick question from my side, and maybe both of you can answer this, but Bayo, this will be more to your presentation. One of the biggest problem we have in Kenyan setting or African setting in general is that there's a lot of manual work done by people who are doing their own work on their own, the Juakali type, the informal sector, and there, once these people are maybe least informed of all the hazards and things like that. So how do you start about talking about management system to such a large population of workers who don't even know what OSH management system is?
Yeah, my straightforward answer, I think did mention that. I recognize Juakali and the informal sector, and because it's informal, so the management system also should be informal. That's a practical way to manage it. It doesn't have to be written down, but first starting with education, starting with awareness, understanding the risks that they're exposed to, and also putting very simple risk management in place for them, and also focusing on which one is the which one, what exactly is the risk. If you, for example, if your colleague, one of the operations your colleague will be looking at in metal work, what's more important? What's wildly important using for what we refer to as the 4DX, which is the four discipline of execution. What's widely important? What is the greatest risk? If North is the greatest risk for them in your Kali operations, we'll focus on that. We don't need to write anything down because their level of education anyway. So we approach it in a very simple manner. We start by educating them. We start by going to the workplace and also providing them with very practical solutions. Let them wear ear defenders, for example, and teaching them on how to wear it, the impact of not wearing it, and also what that can cause in a decade. So if we use that approach for Juakali, yeah, that'll be very useful. Then we because if you're implementing management system, basically we're referring to employers with 5, 10 employees, those who can easily be fined by the government, for example, because they registered, they go for government meetings, but someone on the streets definitely will not even understand what it is to write and sign off a management system. So the best practicable approach is that very simple, informal, not complicated kind of education and awareness, and just providing them with the resources, providing them with what they can use to protect them. That alone is enough management program. I hope that's useful. Maybe Susan, also from your experience, you might want to also add a couple of things.
Thank you very much for that. I like the approach you presented, that this is the informal section and the management should also be informal. So and that's a good approach. But important thing is that they have some sort of management and they are familiar with the hazards and the risks involved in the work they're doing. So if there are any further questions, we have some few minutes, just maybe 1 or 2 more questions before we stop this discussion. And
I see that there are 2 questions that relate to musculoskeletal disorders. I can answer briefly as well. But I would add my question actually to you, Abdulkadir. It has to do with the response that Bayo gave, which I thought was fantastic, because you have to, in the informal sector where individuals usually have a lower education, you have to keep it informal and you have to keep it simple, which means that you inform people about the highest risks that are there and the best practices for those risks to mitigate the risks, which is also for musculoskeletal disorders. Are there outreach programs in Kenya?
Are there outreach programs? Actually, I don't know how to answer that question. So probably maybe somebody from the directorate. I know there are a number of people from the directorate who are taking part in this discussion. So if one of them can help me answering that question, because I don't know the answer to that. Mm-hmm. But I suppose there are some. I understand there is in the Ministry of Labor, there is a department which works with small and medium-sized enterprises, supporting small and medium-sized enterprises. So I would think there is some outreach to some extent, but how much that outreach reaches to the informal sector, I don't have an answer on that.
No, but I think that's in order to be able to implement such a system, you'd need to have outreach programs in place on how you would reach people working in the informal sector.
I'm sure with the director is not here. He had some other commitment, but probably the Directorate of Occupational Safety, Health and Services, through the county occupational safety and health officers, they have some kind of outreach system. I cannot say what it is or how it works, but I believe that because they have the occupational safety and health county officers, these probably some of the assignment of these officers is outreach. So, but I cannot say what they do. I
It
don't
would be
because I don't have that.
interesting to know whether they have the responsibilities, as Bayo was talking about. Who is responsible for these individuals, and which responsibilities do they then have?
That's true. We'll always have that question. I think not just in Kenya in the informal sector, but also in the formal sector and everywhere else in the world. Who is responsible? That question will always be there. So I don't see any further questions. So I would like to thank you, both of you, Dr. Susan Merkus. Thank you very much, and Mr. Bayo Awosanya, for this very nice presentation about very important issues for workers, for the management, for everybody. So thank you very much. And now we've come to the last part of our conference today, and this is to make a short summary of what we've discussed. So I've tried to take some few notes. I'll try to see if I can get to get a short summary of what we've done. I cannot do a lot because it's been a lot we've discussed from yesterday when we started with Catherine Bresch from Federal Institute of Occupational Safety and Health in Germany, who demonstrated to us on how to use the EMKG tool set for risk assessment of workplace, for chemicals, use of chemicals. And starting from this morning, we heard from the director of DOSH on development of Oil Safety Act and the First Aid Act and the process which the directorate has taken to develop these acts. We had after that on depression and the different types of depressions, about diagnosis, treatment, and how we should be open and talk about this depression, because you start getting help when you talk about it, and the professional psychologists, clinical psychologists can help with identifying the different type of depressions. We heard about changing nature of work from Dr. Yogindra Samant, and we heard from starting from the matchstick workers, how technology has developed, and platform economy, how the disadvantage or the potential hazards, occupational hazards with those, and or challenges with occupational health when we talk about platform work. We heard about pandemic and challenges with pandemics. We heard about how climate change and how this will affect some workers, and we also heard of vulnerability of migrant workers, not necessarily from other countries, but from within, from the same country, people migrating from their rural homes into the cities and expecting to get some work and ending up doing work which has no control. And how not to individualize prevention. And then we had about challenges with asbestos from two speakers, where we had about the problems of disposing asbestos, for example, roofing tiles, without following proper management systems, and getting these asbestos roofing tiles people are getting them back into the community and using them without being aware of the potential hazards of the asbestos. And then we heard about how Norwegian authorities and the National Institute of Occupational Health have worked together in combating the problems with asbestos, and several reports are written to that end. And then we had we had a quiz contest, and I have to bring this up again, that Naomi won the quiz contest, and she has bragging rights that she's the champion of OSH Conference 2021 quiz until next year. That's Naomi. That's for you. Then we had about muscular-skeletal disorders. We had about the different problems, including Kenya. We had the issue of the primary school teachers and the nurses in Kenyatta Hospital and in Mombasa County hospitals. We had about how psychosocial factors also contribute to muscular-skeletal disorder. This is something which I had never thought of. We always thought of muscular and skeletal disorders will be associated with manual work only, but we can see how psychosocial work environment also can contribute to increasing the pain or making the injuries chronic and worsening situation. And we heard about what to do to reduce the risk factors, to ensure variation and enough breaks for recovery, organize and facilitate for work tasks, and knowledge. This is always coming up, that people have to get knowledge and to know what they're doing. And Dr. Merkus was kind enough to show us a link to the tool developed by the Swedish authorities of the RAMP tool, which is a risk assessment tool for muscular and skeletal disorders. So I will encourage that you go and look at it. And then the last speaker, Bayo, talked about OSH management system, how to implement, very important, and he mentioned about ISO 45001, and went through the process of implementing this and ending up to getting a certified ISO 45001. And he talked to us about the need for management system, a robust management system, and how beneficial that is. And among the most important benefits is protecting life. This is in a nutshell what we've had today from yesterday and today from the various speakers. And I'm very thankful for all the speakers, for the time they use to spend on preparing for this conference, and all the participants who spend their Saturday with us instead of going shopping, because Saturday is the day people go shopping, and on Sunday people relax at home, and those who go to church. So we've taken the day where you're supposed to go shopping, and we still hope maybe you can get the shopping centers still open, and you can have the last part of the day. So if there's any question or any request, I want to give the word to Imran before we close the session. Imran.
Yes, thank you, Abdul Kadir. I think I'm one of those people who is probably going to head to the shopping center in a few minutes. I just want to say thank you to everyone who attended today. For those of you who stuck around to the very end, Congratulations, you have the discipline of a Roman soldier. And thank you to all the speakers for giving us their time. Thank you, Suzanne. Thank you, Bayo. Thank you, Dr. Andrew, Wafia, and all of the rest. Thank you all for making this a success today. And again, to repeat the announcement of yesterday, for those of you who still do not have the EMKG tool, and I imagine it's only a few at the moment, please do reach out to me. I will drop my number in the chat. Reach out to me, and then I will find means of arranging so that you can we can have that tool delivered to you. Once again, thank you everyone, and as we promised, we are planning to, from next year, to have these meetings be more physical. So we'll have them like we're used to having them in Mombasa, hopefully, maybe even in Nairobi, who knows? I think that's a discussion for another time. But thank you all once again, and see you next time.
Yes, and for the physical meetings, of course, Susan, you're welcome. Bayo, you're welcome. Bayo has been there before. Susan wanted to come last time, but something happened. She couldn't make it. But we hold you to that you owe us a visit, and we look forward to seeing you. And this goes also to all the other presenters and the speakers and those taking part. We are looking forward to a physical meeting. This was the last event of the year for OSH Pro Services. We'll start again, God willing, in January, and we hope to get some speakers to start with our OSH webinar series 2022, as we've done the previous 2 years, building up the series, building up to this this conference, which we hope the corona situation will allow us to meet physically. So thank you very much. Have a nice rest of Saturday. It was very nice having you here, and we look forward to seeing you again and to supporting OSH Pro Services as you've done in the last few years. So have a nice evening or afternoon, depending on where you are in the world. And we hope to see you again sometimes again. Thank you.